Hello, welcome to this edition of Silver Sneakers Boom Muscle. I'm not going to be able to do an exercise session today. I had some important information concerning myself that I want to relay, and also that might be important for other seniors as we're trying to improve our fitness and our health. If you recall, been following my videos, I had prostate surgery in the middle of November, was recovering well, feeling pretty good. Up until last week, I found that if I went up a flight of stairs just at a normal pace, not carrying anything, I got very short of breath and lightheaded. This symptom would last for a minute or two. I didn't pass out, but it was pretty unusual because I am used to carrying a heavy box of wood, might be weighing 40 or 50 pounds up those stairs, usually with no problem. So that was a change in my health. That continued for a couple days, then I found walking outside up a gentle slope, I got some chest pain. So if you know, I'm a retired physician, I recognize that that certainly could be the onset of cardiac ischemia, decreased blood flow to the heart, otherwise known as angina pectoris. So took myself into emergency room, got an evaluation, EKGs showed everything looked normal, lab tests, troponins, etc., all normal. We ruled out pulmonary embolism, and didn't find anything. Recommended I follow up with my primary care, who referred me for a stress test. Went in the following day for a treadmill stress test, and as they hitched me up to the leads, and I'm just laying on their gurney waiting for the test, they noticed that my heart rate's running at about 145 beats per minute and somewhat irregular, and diagnostic of atrial fibrillation. Atrial fibrillation is when the atrium, the top part of the heart, are not beating effectively. They're sort of in a fluttering spasm type activity. It reduces your cardiac output by maybe 20% or so. Lots of causes for atrial fibrillation. We see it occurring as people get older, often due to occult coronary artery disease, causing ischemia to the heart. It can occur from thyroid disease. Sleep apnea is a common cause. Obesity is related to atrial fibrillation, and there are other causes as well. So I have to take it easy until we sort this out, find out what's going on, make sure I'm not having a impending heart attack from coronary vascular disease, and if there's any treatment for this at this point. The ultimate treatment for atrial fibrillation is if you can get it back into the normal sinus rhythm. That's very beneficial. Sometimes the physicians can, sometimes it doesn't work. The other aspect is to control the rate of the ventricles. So when I'm just laying around, if my ventricles are pumping at 145 beats per minute, that's pretty close to my maximal heart rate, and maybe not very effective, and also putting a huge strain on the heart. So we want to slow the heart rate. They've been started on what they call beta blocker, metoprolol, or to slow the ventricular rate, also can lower blood pressure. And as I'm getting used to the medication, I have to be careful about, again, getting lightheaded if I move too quickly, stand up, make sure I'm not dehydrated, and see how that medication works for me. So I'm going to get an echocardiogram today to see what's going on, whether the heart is pumping effectively, if there's some other issue. I'm going to see the cardiologist in a couple weeks, and I'll keep you updated on how I'm doing. The measures to try and improve atrial fibrillation, first of all, in my case, would be to lose body fat. So with the new year coming up, it's a good time to get on a body fat reduction diet. Evidence has shown the diets that prolong life, most beneficial, are in the Mediterranean type diet, the DASH diet. While other diets can help you lose weight, haven't really been demonstrated to show improvement in longevity or heart health. The weight loss medications like semaglutide, etc., possibly beneficial. Don't know yet. I'm going to see how I do on a regular weight loss Mediterranean type diet. Avoiding alcohol, avoiding excessive caffeine, modest exercise, walking, some moderate resistance training to try and keep your muscle tone up. These are all beneficial. Again, going to be evaluated for sleep apnea. Some people with sleep apnea snore. Sometimes you don't snore, and it's just sort of a quiet, decreased oxygen when you're asleep, which puts a huge strain on the heart. So I'm going to get a test for that. So as far as boom muscle, it's going to take me a few weeks to get back to a true boom muscle activity. In the meantime, I'll be working on activities such as Silver Sneakers Yoga, maybe Tai Chi, other formats that I am credentialed in and practice, which I'll do more of. I love lifting weights, but I got to be careful, particularly with the full body things like squats and deadlifts. I think exercising my arms, upper body, as long as it's reasonable and not overexertion, would be fine. So I'll keep you posted on how I'm doing and other medical advice as I come across it. And I try and give advice based on how I used to practice, which is consistent with, I believe, the best evidence out there, and all trying to avoid extreme ideas that aren't scientifically proven. Have a great week before Christmas, lovely Christmas, and I hope to talk to you again before New Year's. Thank you.